Joining us now, Dr. Natasha Bagdasarian with the Michigan Department of Health and Human Services. And Dr. Bagdasarian, thank you so much for joining us here on First at 4.
Thanks for having me on.
According to the CDC, TB, as it's commonly called, is one of the world's leading causes of death for infectious diseases. What makes tuberculosis such a severe infection of the lung?
Well, tuberculosis is something that was, in fact, even just less than 100 years ago, killing lots of people right here in places like Michigan. And we've made a lot of progress with tuberculosis with antibiotics. And we now have treatments that are effective against tuberculosis, and we've got ways of managing this illness. And so this is not an illness that we see terribly often in places like Michigan, but in some parts of the world, it is still a relatively common infection. And as with any infection, there can be severe cases. And with tuberculosis, we can sometimes even see death.
What are symptoms? Is it like a common cold, or are the symptoms for tuberculosis different than your common cold or flu or even RSV?
So when we think about things like the common cold, we think about illnesses that are really short-lived. We think about people falling ill suddenly and feeling ill for a few days and then recovering. Tuberculosis is something quite different. When someone has active TB or pulmonary TB, what we're really talking about is a chronic cough. So when someone has a cough for more than 3 weeks, when they are having fevers for that period of time, night sweats, unexplained weight loss, and even coughing up blood, those are some of the signs of someone with active tuberculosis.
Is there anything at all you can tell us about the case in Kalamazoo? Are there concerns that that case could spread to other parts of the state, or is it pretty isolated at this point?
Well, I'll tell you in general what we do with tuberculosis. When there is a case of TB, this is really something that public health takes very seriously. This is the reason why we don't see people with tuberculosis and people getting very ill and dying from tuberculosis today in places like Michigan. Public health does what we call contact tracing. So when there is a single case of someone with active TB, when they're coughing and potentially exposing folks around them, public health will go in and do very detailed interviews to find out who could be exposed. And then the individuals who have potentially been exposed are screened. So we have all kinds of protocols and public health activities around tuberculosis. And TB has really been a huge success story for public health. And this is the whole reason why we need really strong, robust public health systems.
Yeah, I know, many years ago, when applying for a job, sometimes you would have to take a TB skin test. Is that still the method by which a TB is diagnosed? And if so, how do people protect themselves from, is it a virus, the virus itself?
So it's a bacteria. Mm-hmm. It is Mycobacterium tuberculosis is the name of the bacteria. And there are typically two main forms that we talk about. I mentioned active TB or pulmonary TB. So that is when someone has an active infection in their lungs, when they are coughing, when they have symptoms, and when they are at risk of transmitting this infection onto other folks. TB can also leave the lungs and go to other places in the body, but that's active infection. Now, there's another entity called latent infection or inactive infection, and that means that someone has been exposed to TB. They do have the bacteria usually sets up shop in the lungs, but then the body sort of walls it off. And so that's an individual who does not have symptoms and does not pose a risk to other people. Now, for latent TB or this inactive form, there are a couple of different ways that we screen for it, because again, this is someone who's not having any symptoms. Mm-hmm. The screening can either be a TB skin test or a blood test. So there are two different ways to screen for latent TB. Now, when someone has active tuberculosis, this is someone with symptoms, we would usually go to a chest x-ray and look for signs of tuberculosis. Usually we see changes in the upper portions of the lungs on a chest x-ray, and then we would also check the sputum and actually look for the bacteria in a sample of their sputum.
And doctor, very quickly, where can people go to get more information if they'd like to learn more about TB?
So you can go to the CDC's website. They've got really important updated information on tuberculosis. We also have information on the Michigan Department of Health and Human Services website. And if you are someone who feels that you've been exposed to a person with tuberculosis, I would call your local health department or talk to your primary health provider. If you're someone who's having symptoms and you're concerned about symptoms of TB, the symptoms I mentioned, things like cough lasting for longer than 3 weeks, night sweats, weight loss, unexplained weight loss, fevers, I would again seek medical attention and talk to a healthcare provider.
Dr. Natasha Bagdasarian with the Michigan Department of Health and Human Services, thank you so much for joining us this afternoon. Have a great day.
Thanks for having me on.